Whenever someone takes a medication, a supplement, or does pretty much anything else to improve their health, their body can respond and produce symptoms. It's important to understand what these symptoms are and why the body is producing it, because maybe these symptoms indicate a true harmful reaction to a substance, or maybe these symptoms represent the body attempting to heal itself. In conventional medicine, a side effect is simply an effect, whether therapeutic or adverse, that is secondary to the one intended. Technically speaking, the term side effect just refers to any effect. It doesn't necessarily have to be a harmful effect, but in practical terms, when you see this term side effect applied to a medication, some other medical procedure, a supplement, is almost always going to be used with the implication that this is a harmful, unintended effect that you don't want. Just to show how useless the term side effect is in terms of understanding if the side effect represents a beneficial effect or some type of harmful effect or poisoning from the agent, Wikipedia goes on to say that something that was once a side effect might be then considered to be the primary effect depending upon the intended use, and they use x-rays as an example. The naturopathic doctor John Bastyr summarized this problem best when he said that there's no such thing as side effects, just effects. When you do something for your health, you take a medication, you take a supplement, you go out jogging, whatever you are doing for your health, what that does is what it does. And the totality of the effects of what it does is its effects. Classifying things as side effect or intended effect, it gives the implication that the supposed side effect is a lesser effect, of it being a less important effect, of being some effect that we can just kind of throw to the side. It's not. They're all effects. And the example I'm putting up there is statin drugs. They have their primary effect at lowering cholesterol. They have the side effect at lowering coenzyme Q10, which can cause muscle aches and pains and actually lead to cardiovascular disease. They're both effects. One is not a lesser effect than the other. I think we have this vague and confusing terminology in the world of conventional medicine because they're treatments are basically poisoning the body. Again, with Lipitor to lower cholesterol, it's poisoning the liver so the liver cannot make coenzyme Q10. You're poisoning metabolic pathways without asking the question of why is the body making cholesterol to begin with. When you poison the body as a mode of treatment, you're going to get lots of toxicity responses. Calling these toxicity responses side effects really doesn't change the fact of the matter what they are. They are toxicity responses. And then in natural health, we have the concept of a healing crisis. This might also be called the detoxification response, a Herxheimer response, a die-off response. This is when the body produces symptoms as part of a healing response. I know there's a lot out there on this slide, but progressive icariation means toxins are moving deeper into the body. That toxin might be from the environment like mercury. It might be a virus. It can mean things coming in from the outside world, moving deeper into the body, impairing cellular function, and eventually causing death. In order to heal from toxicity, the body has to use its energy and resources to take those toxins out of where they're being held. Depending upon where they're being held, it might take a lot of resources if something's being held deep in tissue. It might take less resources if you were food poisoned and your body needs to vomit to get rid of it. The point is that in order to heal, to go through what's called regressive icariation, to move toxins out, the body is going to have to produce symptoms to respond and get rid of the stuff. So these healing responses are not the same as the toxicity responses of medications that are so commonly called side effects. And the problem we get in conventional medicine, when people then want to start comparing the effects of herbs and supplements to medications, is a lot of times in the world of natural health, we're dealing with healing responses. In the world of conventional medicine, we're dealing with toxicity responses. They are not interchangeable. But by just calling every response that doesn't feel good as side effects, it kind of muddles the line. It makes it seem like, oh yes, you can take a medication and it has side effects, and these supplements have side effects also. And while that is true, and it definitely is true that supplements and herbs can be used irresponsibly to cause toxicity responses in of themselves, we want to keep in mind that in health, we are working towards healing the body on a deep level. We're working on stimulating the body to use its resources to repair itself, and that involves producing symptoms. Some of these symptoms are not going to be pleasant, and this is one reason why, if you're working with a good practitioner like a naturopathic doctor or someone else in natural health, they should understand that the body can produce these symptoms and do things to mitigate the degree of detox responses that someone is going to go through. You want to have a gentle healing crisis. But yeah, if you have someone who's terribly toxic and sick and you put them through an aggressive protocol, we can see that tired, headaches, diarrhea or smelly urine, that can be a sign that the body is moving junk out. That happens all the time where if I'm working with someone like metal detox or something like that, and then they'll say, well, the urine smells different. And I'm like, good, because you want to get that stuff out. Skin rashes, skin is an auxiliary route of detoxification. If the liver and kidney cannot handle everything, you can see it come out through the skin. Increased mucus. The body might want to get rid of something that's stuck in the membranes, in like the sinuses or the throat. The body's using mucus as an auxiliary route of detoxification. Even nasal bleeding. Yes, within the blood, moving toxins out. Muscles and joint pain. If the body is mobilizing toxins out from tissue and it can't get the full mobilization from the storage in tissue out through the lymphatics, you can have toxicity and acidic waste build up around muscle and joint and get pain there, insomnia. So these are signs of healing within a natural health protocol. But we need to understand what's going on, why these things are being produced in order to differentiate the difference between a side effect and a healing crisis. This here is an image of a lomation rash. Lomation is a very strong antimicrobial, antiviral herb, and when people take it, especially by itself without any other support for the liver, it's possible to get a rash that can cover the whole body. Usually the rash starts around the head, neck area and moves from the inside out. We're going to get to that very shortly. But this is a healing response. Now, a good practitioner, a good herbalist, will know lomation can do this. So would either combine lomation with other herbs to help detoxification in the liver, or would use other herbs and reserve lomation only for when it's really needed. But the important thing is that this is not a toxicity response. This is not a sign that the body has been poisoned and has metabolic pathways and hindered because they took a drug. As a naturopathic doctor, someone tells me that they had a set of symptoms, so they took some drug or they took some supplement or herbs for it. I need to be able to figure out, was their response a true healing response indicating that they're moving towards health, or is there a response showing that they are actually moving deeper towards disease? And just simply saying, oh, these are side effects, it's completely useless for that. And I say anyone who's using the side effect concept, especially all the medical doctors out there, when you go in to see them, if that's all they can say is this is a side effect of that, then they really can't say, are you moving closer to health or not? And that's what we want to know. Herrings Law of Cure gives us a tool to understand if the responses that you are getting from drugs or supplements or homeopathics or herbs or other healing modalities is moving you closer to health or moving you closer to disease. This is all based on simple observation. Healing happens from the inside out. It happens in the reverse chronological order of when the symptoms came, and it happens from top to bottom. We're going to go over these, but I want to make the point that as simple as this is, this was developed by practitioners who watched their patients. They observed their patients. They observed the symptoms. They observed the progression of symptoms. And they saw if their patients were getting better or worse. They didn't just have someone come in with some responses and they say, oh, this is a side effect. Maybe I should give you this drug for a side effect. And without looking, is someone actually getting better or worse? So we need to have respect for the practitioners who develop these simple concepts because they learn to observe their patients. The first law, healing progresses from deeper parts of the body to more superficial. Some of the deeper parts, mental, emotional, to then vital organs, to then external extremities. This can become very complicated. In the world is called homotoxicology. They have very detailed charts to show where different symptoms are in terms of how deep it is in the body. The point is that you want to see the symptoms related towards deeper problems resolve, but then you might see more superficial symptoms come up. For example, if someone isn't breathing well, if they have chronic bronchitis, you might initiate a treatment and then they start coughing up phlegm. Well, they might get a cough or a sore throat, but that's more superficial than bronchitis, so it means that you're moving in the right direction. And I'm adding this in because as drugs poison the system, we see a progression of symptoms from outside to the vital organs. A very common manifestation of this would be antibiotics for upper respiratory conditions. Someone has a cough or a cold and they get some antibiotics and they keep on taking antibiotics. Next thing you know, they're getting chronic urinary tract infections. Well, going from the throat to an infection in the urinary tract to the kidneys, that's showing something is going deeper into your body. That's showing that when people are treating themselves with antibiotics, what they're actually doing is taking toxicity and driving it deeper inside, because the superficial infection in the throat is simply the body trying to use inflammation and phlegm to move toxins out. When you shut that down with antibiotics, it goes deeper. This is regressive vicariation. We can also see with birth control pills and all the side effects of those. Those are toxicity responses. Women might get heavy bleeding because it's an auxiliary route of detoxification. When they decide to suppress their periods with birth control pills, then their body loses that route of detoxification. They're going to get symptoms elsewhere. The real way to treat this problem is to assist in detoxification so the body doesn't need to go through those painful periods with heavy bleeding. But those are two examples of how people poison their bodies with supposed medical treatment and simply send disease deeper into their bodies. Second law, as healing progresses, symptoms appear and disappear in reverse of the original chronological order of appearance. What this means is that maybe someone comes in because they're tired. We initiate a treatment, and suddenly they might start getting that sore throat, or they'll get that skin rash, or they might get some ear symptom that they used to have years ago. When that happens, I know they're moving in the right direction because the symptom they're coming in with is improving, and now they're getting an old symptom. That's because years ago, when their body was producing that symptom, it was an attempt at healing themselves. And so the body produced that symptom to try to heal. It wasn't enough. They didn't have enough resources. They didn't have enough energy to actually heal them. So the body stopped producing one symptom and then years later produces another symptom in order to try to heal from the same problem. Because at that point, the problem has moved deeper into them. So as you work backwards, as you improve health, your body to a degree will go backwards through the steps it went through on the way to disease. So if you are undergoing a treatment, your current symptoms improve, but a symptom you used to get comes back, this is a good sign. Conventional medicine has no way of interpreting this phenomenon. The phenomenon doesn't exist in conventional medicine. So if you're actually healing and you go to a medical doctor and say, oh, I had this symptom years ago, it came back, that medical doctor, instead of saying, oh, this is a good sign that you're healing, continue doing what you're doing, they're going to be like, oh, this bad that this symptom came back. Why don't we suppress it with the drug? Of course, suppressing it with the drug would just simply sabotage all the healing work that you've been doing. The third law is that healing progresses from the upper parts of the body to the lower parts of the body. We see that in skin rashes as, I think, the best example. If someone has a rash like this, and you initiate a treatment, if that rash goes from the knees to the ankles, that's a good sign. If the rash in the reverse goes from the knees up to the abdomen, that's going to be a bad sign. We can also see this with, say, Lyme disease, where people have aches and pains and their joints start to really hurt. When they get better, it's possible for a lot of the joint pain to leave, but it's still hurting them in their elbows, or it's still hurting them in their wrists or their fingers. As long as that pain is moving outward, that's a good sign. So to revisit this idea of side effects, A side effect being an unintended effect is pretty much negative and is a consequence of a treatment harming the body. In natural health, when we work on detoxification and the body starts to react by producing symptoms, those symptoms are not unintended effects. We intend the body to react. We intend for the body to produce symptoms and heal. We don't intend for it to be out of control and something that's unbearable, but we do intend for those reactions to happen. We may not always be able to exactly predict how someone will detoxify, but we can predict that the body will go through a detoxification response. A good practitioner will know the case history and take steps to mitigate detoxification responses. Although since they are the body's natural and healthy healing response, the goal is not to eliminate them completely. And it's always a challenge as a naturopathic doctor when you work with people on detox to get them well and do so in a comfortable way. And it does happen at times, especially with very sensitive people. You can do very gentle things and you might get big responses. But you have to move forward and get the stuff out. And sometimes there are people where they'll have a detox response and they know, okay, this is what they have to go through. It's a healing crisis, and they just go through it and they get well. And what you really don't want to do if you're going through a healing crisis is to say, oh, I have these new symptoms, I should run to the medical doctor and get some steroids or antibiotics. As soon as you do that, you're aborting the healing process and you're sending the disease deeper into your body. You're going back through regressive vicariation. So the thing to do is just don't do that. If you do have a difficult or unbearable healing response, yes, you can slow down what you're doing that's causing it. Also, a good practitioner will probably have ways to mitigate that response so it's much more comfortable. However, to some degree, to truly heal, you're going to have to go through this type of healing crisis. Your body has to get rid of the toxins and it has to go through various repair processes. And that means going through symptoms. In order to understand this and guide people through the process, the practitioner must be able to determine, is something a healing response or is it a toxicity response? Calling things side effects is completely useless, and I wish they just get rid of the whole concept altogether. And what they should do for all these drugs, when they list side effects, they should get rid of the term side effects, and they should just list toxicity responses. You're poisoning your body. And yes, the exact same thing can happen with irresponsible or wrong use of supplements and herbs. However, I think a large amount of the time, probably the majority of the time, that people get these symptoms from taking supplements, they're really going through healing crises that they don't have enough support to get through. But when it comes to studying these substances and treatments, because we have this concept of side effects, the toxicity response of medications kind of gets lumped in with the healing crisis response of natural treatments. And then you'll hear that anything can produce side effects. And that's true, anything can produce side effects. Anything can be a toxin, including water. That's called drowning. But we need a way, again, to differentiate the healing response from the toxicity response. And that's what Herrings Law of Cure does, and that's what conventional medicine has no concept of whatsoever.